Hi, it's Suzy from Active Seniors here with another quick exercise tip for you. Now, if you're someone that experiences back pain, today's tip is going to share with you 2 simple tests that you can do and then some of the recommendations of exercise modifications that you might need to make based on the outcome of those tests. Now, the first test that we're going to do involves one of my favourite movements, which I haven't done for a while. It's the calf raise. What we're going to do, we're going to place both hands onto the chair. You're going to raise up as high as you can, and then you're actually going to let your heels slam back down onto the ground, like so, okay? Now, if that gave you any pain into your back, so we're not looking lower down now, but into the back area, or if you decided that you didn't want to slam too heavily onto your heels because you were worried about pain in your back, then it's a good indication that you need to be a bit more cautious with what we would call impact loading exercises. Those are exercises such as step-ups or stair-based exercises. They might involve some bouncing or at the extreme jumping and hopping. And all of those exercises will create an impact force through the back that if you found you got pain during this test, the back won't tolerate it without an increase or an aggravation of symptoms. Now, this is just something short term, and obviously you can redo the test to find out how sensitive your back is, and you should be able to get to a point where you can do the test without having an increase in your symptoms, and that's when you know to include those exercises back into your program. Now, the other test that I'm going to show you is what the compression tolerance of your back is like. You just need a chair. You're going to sit down onto the chair, up nice and tall, and you're going to hold underneath the chair. You're going to try and pull your hands up so that you're squeezing your body up against the chair, and that's going to create a compression force. So holding underneath, pulling yourself so that you're trying to pull the chair up to your body, and then holding that for a few seconds and relaxing and seeing if that creates an increase in pain in your back. Under normal circumstances, that shouldn't create any problem or any pain in your back. But if your back is a little bit sensitive and you found that that was painful, then it just tells you when you're doing some of the exercises, rather than picking up a weight or using any household objects to do the exercises, if you can, try and use your body weight only, and to increase the difficulty, instead of adding extra weight, try and slow the movement down or perform more repetitions. This will be tolerated more because it's less additional compressive load on your back. All right? So I hope that you've enjoyed today's tip. I hope you're enjoying the 12-week program so far. Keep up with all the exercises and feel free to reach out if you have any questions or any comments. But in the meantime, stay safe, stay active, and we'll see you soon for another quick exercise tip.